Good morning, everyone. I am Bridget Leahy, Senior Director of Public Policy with Planned Parenthood Illinois Action, the political and advocacy arm of Planned Parenthood in Illinois. My pronouns are she, her, hers. Welcome to our press conference on the introduction of the Responsible Education for Adolescent and Children's Health Act, better known as the REACH Act. We will be taking questions at the end. However, because we are hosting this press event via Blue Room Stream, you will need to submit your questions by email to mj@ppil.org. That's mj@ppil.org. Today we have as speakers the sponsors of the legislation, as well as representatives from three organizations that have been working on this legislation since 2019. First, we have Senator Ram Villavalam, who represents the 8th District in the Illinois Senate. The senator has spent several years serving on the Education Committee and has been an advocate for quality education for students no matter their zip code. The senator's pronouns are he, him, his. Senator, if you want to go off mute and join us.
Thank you, Bridget. Good morning, everyone. And I hope that my 2-year-old continues to play quietly and not, interrupt us, gently, I guess. Hopefully, if he interrupts us, it's gently. But it's good to be with everyone this morning. Thank you so much to Planned Parenthood, Equality Illinois, and the entire coalition that has brought this legislation forward. I know that it was a lot of work to go across the state and have these conversations and find out how exactly we need to move forward to make sure we get this done. It's good to be here with Representative Willis and the other leaders on this issue. We need to move forward on this issue, and it's great to be working with folks that have worked to champion it. I am here today as a person from an immigrant community, a young father, and I'm so proud to sponsor the REACH Act. I believe strongly that this is critically important legislation that, here we go. It lasted maybe 30 seconds. But this is Rohan, everyone. And I just wanted to again acknowledge the fact that I'm proud to sponsor the REACH Act. This is incredibly important legislation to do both, ensure that our kids are safe and healthy, and also ensure that we are teaching our kids what's appropriate in terms of medically accurate information, in terms of how to interact with one another and become positive, producing individuals in our society. There's no question that in recent years, the news has been filled with reporting on child sex abuse scandals, sexual harassment in the workplace, sexual assault on college campuses, and bullying of LGBTQ students and people of color. Our youth see this coverage. They're watching this news. They're around people that talk about this. And now more than ever, they need medically and factually accurate information, as well as a safe environment to develop the skills they need to navigate our modern world. And so I am excited to be working on comprehensive personal health and safety education that is K through 12, and that will really give our kids the opportunity to learn what they need to learn in a safe and proactive environment. And so I strongly believe the time to act is now. And that's why I'm proud to be sponsoring this legislation. And with that, I'll pass it back to Bridget.
Thank you so much, Senator. Next, we have the House sponsor. Representative Kathleen Willis represents the 77th District in the Illinois House. Representative Willis is a former board member of the Addison Elementary District 4 School Board, and her pronouns are she, her, hers. Representative Willis.
Thank you so much, Bridget, and thank you, Senator, for setting up this. And I am so proud to be the House sponsor of the REACH Act. As a former school board member, I've always been actively involved in what we feel is the best curriculum for our schools. And when Bridget came to me with this request, I was a little taken back in the fact that I actually thought that sex education and relationship education was mandated throughout the schools. And I actually found out that it was not. It's piecemeal. And that was something that really concerned me. We need to take a overall arching look at this, and we need to make sure that it is for all grade levels. And it is not too early to start teaching children as young as preschool and definitely by kindergartner about healthy relationships. We are hearing more and more about kids that get bullied at a young age. And that is something we need to take a step forward on. And by bullying, it just goes into the next step of other things that can happen. And we know that that is so important to prevent that from our youth to happening. So that is why I am so proud to be the sponsor. It goes and it has age appropriate guidelines for us. So we're not teaching kindergartners something that is beyond what they can understand. We're teaching age appropriate stuff about healthy relationships. By teaching children at a young age about healthy relationships, as they progress and get older and older, and those relationships become more and more complicated, they can understand how to deal with that. By doing this at a young age, making sure that we take those steps forward and we follow the guidelines, we can hopefully have young adults that understand when they are being abused and how to get out of unhealthy relationships. And that's the most important thing that I think the REACH Act can bring to us. It can prevent kids that are having terrible sexual assault happen to them understand that no, this is not supposed to happen. This is not the grounds for a healthy relationship. And they can have adults in their life, hopefully their teachers throughout school or other adults that they feel safe in going to. And that is all part of the REACH Act. It allows all children, K through 12, all sexual orientations, all races, everybody to have a safe zone and give them the tools to say, hey, this isn't right. This is not what I was taught about how a healthy relationship should be. To be able to say, stop this bullying, make sure that we have a safe zone and feel that they can grow to be young adults and be safe as they do that. That is one of the reasons I am so happy to be a sponsor of this. I am looking forward to having this go forward and make sure that all of our school districts can follow the guidelines that we have put through that will be sanctioned by the State Board of Education. Another thing that we're going to be working hand in hand with them as we go through. And I'm so happy to be the counterpart of the Senate on the House sponsorship of this bill. So thank you so much for having me be part of this. Bridget, it's back to you.
Thank you so much, Representative. I want to remind any reporters who are watching that you can submit questions to mj@ppil.org. Now we have Dion Strathman, Director of Community Engagement and Adolescent Health Initiatives at Planned Parenthood of Illinois. PPIL provides sexual and reproductive health care to more than 70,000 patients and provides education to thousands of students in school and in community settings each year. Dionne will accept any pronouns that are respectful. Thank you, Dionne. You can go off mute.
Thank you, Bridget. Hello, everyone. As Bridget just said, my name is Dion Strathman. I am the Director of Community Engagement and Adolescent Health Initiatives at Planned Parenthood of Illinois. I've worked in schools teaching healthy relationships and sexual education for well over 10 years. I've taught in classroom settings, community organizations, summer programs, and even juvenile detention centers. No matter the setting, young people want to talk about sexual health. They want to discuss consent and healthy relationships, and they want facts, not scare tactics and shame. Sex education covers a wide variety of topics. When our education team goes into a classroom, we may be preparing a young person for changes in their bodies, such as discussing the stages of puberty or personal hygiene. We may be covering reproductive anatomy and explaining the functions and cycles of these body parts. We may be supporting safer choices by covering topics like STIs and birth control, or we may be there to discuss consent and healthy relationships and why these two things are important in all relationships, not just romantic ones. When young people have sexual education, they are better able to make informed decisions about their bodies. In fact, studies show that students who receive comprehensive sex ed are more likely to wait longer to have sex and more likely to use condoms and birth control when they do. Unfortunately, not all young people receive sexual education, and those that do often do not receive the quality that they deserve. We need the REACH Act to ensure that all young people are receiving a comprehensive sexual education, an education that is fact-based, age-appropriate, and inclusive. I really want to emphasize that word inclusive. In the classroom, students tune out when they do not feel included. They think, this picture doesn't look like me. These relationships don't look like mine. This information must not be for me. Sexual education is for everyone, and quality education celebrates diversity. It does not alienate. Inclusion is teaching about and validating different bodies, genders, and sexual orientations. The REACH Act seeks to create a space where students feel seen and validated in the classroom. This is especially important when discussing consent and healthy relationships. Since the Me Too movement began, more young people are having deep conversations around consent and boundaries. These conversations are amazing and a great example of how national dialogue shows up in the classroom. In fact, in the past few years, our most requested workshop has been healthy relationships. But we do a disservice to young people when specific communities are left out of this conversation. Sexual education also helps people plan for the future. I cannot tell you how many high school students have told me they intend to get an IUD or implant so that they don't have to worry about pregnancy in college. That is planning. That is empowerment. That is why I go to the classroom. But I also go for students who think jealousy is a sign of love, who think condoms are reusable, and students who believe everything that they read on social media. More than ever, our young people are overwhelmed with misinformation and need to know how to separate facts from myths. We owe it to young people to give them the tools to make healthy choices and to advocate for their bodies. They need education. We need the REACH Act to help ensure they receive this education. Thank you.
Thank you very much, Dionne. Now I am really pleased to introduce Cal Vine, a sophomore high school student from Southern Illinois. Cal represents the Rainbow Cafe. The Rainbow Cafe, located in Carbondale, provides a safe and welcoming environment for youth who are lesbian, gay, bisexual, trans, gender expansive, queer, intersex, asexual, or questioning their orientation and or their gender identity, and their friends. By creating a space in which they are affirmed and offered non-judgmental support and access to personal, community, spiritual, and health resources. Cal's pronouns are they, them, or he, them. Welcome, Cal.
Thank you. As before, hello, my name is Cal, and my pronouns are they, them, or he, him. I'm a sophomore at Carbondale Community High School, and I'm representing the youth of Rainbow Cafe LGBTQ Youth Center in Carbondale, Illinois. As an LGBTQ youth here in Southern Illinois, I know that my schools could have done such a better job when it comes to teaching sexual health, personal safety, and how to build relationships. I personally learned very little about these topics from school, topics that should have been clear from the start. In the classroom, we learned nothing about people like me, diverse sexualities, gender identities, and gender expression. Our local Unitarian Universalist community offered a class in which I was able to learn a lot about these topics. For me and my fellow youth, Rainbow Cafe is an affirming space It brings together queer youth from across Illinois. It provides a space to be ourselves as well as to us to learn from each other's experiences. When I talked to my fellow queer youth about our sex education class, they said they felt lost and how our teachers never talked about queer people, like we did not exist. Our schools sometimes ignore our health and wellness needs of all students. We are left to figure all these on our own, and I'm so glad that we have Rainbow Cafe. I then remember not everyone has a Rainbow Cafe, and school should be the main place where we learn about these important life lessons. The social norms aren't quite right, and it's why I'm glad to support the REACH Act and why Rainbow Cafe supports the REACH Act. Illinois needs to ensure that all students are receiving a restful and responsible education that affirms us and supports our health, happiness, and safety. Thank you.
Thank you, Cal. And finally, our last speaker is Miles Brady Davis, Director of Communications and Press Secretary at Equality Illinois, which is our state's oldest and largest organization advocating for full equal rights for lesbian, gay, bisexual, transgender, queer, and questioning LGBTQA people. Miles uses the pronouns they, them, theirs. Miles, take it away.
Hello, thank you. I'm Miles Brady Davis, Director of Communication at Equality Illinois. We are the state civil rights organization for lesbian, gay, bisexual, trans, and queer Illinoisans. My pronouns are they, them, their. Today, we've heard excellent reasons for why Illinois needs the REACH Act. I want to amplify those stakeholders' voices. The REACH Act would ensure all youth in all grades in Illinois public schools are provided with inclusive, comprehensive, medically accurate, and age-appropriate personal health and safety education. The REACH Act is the result of years of outreach and engagement with partners from across the state, including LGBTQ students in Carbondale, Springfield, and dozens of other community organizations. Equality Illinois met with and heard from queer youth, and we asked two simple questions. What are you learning, and what would you like to learn? We were dismayed but not shocked at the answers we heard. One young person told us that their teacher told them that AIDS comes from being gay. Another young person, who identifies as trans, told us that when they asked their teacher for content that affirmed trans individuals, their teacher never gave them any information. Later, leaving that student with no option but to turn to the internet for answers. Later, that student ended up having to teach other trans students about trans health issues. Based on my own experience, I know it's quite common for LGBT youth to teach each other about LGBTQ relationships because there's no such content in the classrooms. We must ensure that all young people are equipped with information that can protect them and teach them about ways to stay healthy, and public schools are the best opportunity for students to access inclusive, medically accurate, age-appropriate personal health and safety education. And the REACH Act ensures that. Thank you.
Thank you so much, Miles. And I'm going to apologize in advance. I think Target just delivered a package to me and I've got some excitement with the dogs, but I am going to pop it back over with questions. So we're going to be opening up things for questions from our media. Remember to submit your questions to mj@ppil.org. Also, as an FYI, Mike Ziri, Director of Public Policy at Equality Illinois, and I are available for any technical questions about the legislation. Our first question goes to Dion Strachman. I'm sorry, I'm tongue-tied. Our first question goes to Dion Strachman with PPIL. And the question is, teaching about sex in kindergarten or first grade just sounds too young. How can you say that young kids need to learn about sex?
Yeah, absolutely. I hear that a lot. And so I do want to clarify that sexual education, of course, is age appropriate and grade appropriate. We wouldn't be talking about sexual activity or sex intercourse in as young as like kindergarten. But there are things that kindergartners really need to learn. They need to learn about things like safe touch and unsafe touch. They need to learn names of body parts, and they need to learn how to be a good friend. And we word these things as good friend, but really we're talking about things like consent and respecting boundaries. So it's something that young people really need to learn at a young age. And just like has been mentioned, to prevent things like bullying, to be able to create those healthy relationships at a young age.
Dionne, thank you so much. I really appreciate that because looking back in my childhood, I was kissed by a boy in first grade who I was practicing a play with, and all the adults thought it was funny, and I was very upset by it. And I think that attitudes have changed. That was a long time ago. And I think now we have opportunities in the classroom to address that so that it doesn't turn into a lesson for a first grader that a boy is allowed to kiss a girl even if she doesn't want him to, and everybody just thinks it's funny and cute. So thank you so much. Our next question is for Senator Villavalem, and that is about schools implementing this. Isn't this too much? Our schools are overburdened. How are they going to do this?
I think it's a good question. It's something, it's an issue that I hear about from our superintendents in the district and principals and other folks in schools. I'll say a couple items. One is the requirements will be phased in over time. Schools will have time to plan, a year to plan and prepare before the requirement goes into effect for grades 6 through 12. They'll have 2 years to plan and prepare before the requirement goes in for grades K through 5. And so the other piece of all this, though, is after hearing, what Miles and Dionne and others have said, Cal, we need to make sure we can't afford for school districts not to provide comprehensive personal health and safety education. And I strongly believe, and I think others in the call do as well, that we need to make sure it's uniform. We need to make sure there's a standard that's put in place. Providing flexibility in some ways as well to the different school districts. But we don't want a situation like the example that Miles, unfortunate and tragic example that Miles gave, where a teacher is saying something that is not medically accurate and very like unfortunate and just wrong. So this legislation is comprehensive, is age appropriate, will ensure medically accurate information is dispersed. And we need to have it. We need to have it in a comprehensive way across the state of Illinois. And so I look forward to continuing to work with our superintendents and principals and others to implement this. But when the question is asked, isn't it an overburden? I view it as it's an overburden not to do this, because we will end up in a situation where we have kids being taught the wrong thing or seeing something on the news and taking that and making an assumption. And that is not what we need. We need to move our country forward. We need to make sure that our kids can be safe and healthy and know how to be appropriate with others.
Thank you very much, Senator. Miles, I know that this is something that has come up from some of the opponents of the legislation who frankly just oppose teaching sex ed in general. And isn't the REACH Act just another way to promote a gay agenda, to be pushed on innocent and vulnerable children? And why would we be teaching young people about being gay, sex changes, and all of that kind of stuff?
Well, first, I would like to say the LGBTQ identity is something that somebody is born with. It's something that can't be taught. My own personal story is an example of that. In 1986, without any exposure to LGBTQ people or knowledge of LGBTQ people, at the age of 5, I came out as trans. And the reality is nowadays kids are exposed to examples of various different gender identities, gender expressions, sexual orientations, different kinds of relationships and families. And schools should need to be a safe place where students are able to access medically accurate and factual information and answer the questions that they have about those issues. Inclusive personal health and safety education will also help fight the systemic erasure of LGBTQ people, which will help reduce bullying, abuse, and violence.
Thank you, Miles, for sharing that. I think that it is important for people to tell their stories and give real concrete examples of why we need change in the classroom, that real people are at stake here and real lives are at stake. Representative Willis, doesn't this bill take local control away from schools?
Actually, no, it does not. It gives the control to the school boards. Interesting enough, I have a daughter that's going through a master's program right now, and we were talking about the role of school boards, and this was actually one of the things that I used as an example. The state would still be setting up the guidelines, but it is up to the local school boards to determine how they're going to implement it and where they're going to do it. So we have put guidelines as to what are the key components that need to be introduced under the REACH Act in certain grade levels. How that gets done is up to the local school boards. They may have outside speakers come in. They may do short little lessons. They may have it be part of the health class. It is all up to the local school board to make the decision at what is best for their school district and how to implement this. We're putting in the guidelines of the key components, but how they get that taught to their students, it is totally still up to the local school boards to make sure they do it. And as long as they put it in within the grade level guidelines that we put in. And we've done that very liberal in a couple of years span so that they have some flexibility in their lesson plans as they go forward. And if nothing else, in my opinion, it empowers the local school board to make sure that they recognize what works best for their students and in their area, making sure that they hit the key components so that all students can have healthy and safe relationships at all ages. Thank you so much for that question, Bridget.
Thank you, Representative. Here's another question. And this has to do with what, if anything, has changed about the bill or what it does since its introduction in the last General Assembly. I'm going to touch a little bit on it, and then I'm going to hand it over to Mike Ziri at Equality Illinois. So Mike, I'm giving you a heads up. The bill as first introduced, and then there was an amendment filed. So there's been a couple versions in 2020. I'll be frank, initially we were frustrated with COVID, as well, everybody's frustrated with COVID, but we were frustrated because we really were gaining momentum in February and March of 2020, signing on a lot of co-sponsors, getting a lot of support from legislators. And we had been listening to folks about their input, and an amendment was filed that made some changes. Then COVID happened, and ironically, it gave us some more opportunity to sit down and talk with various stakeholders. Some of them are groups that we've been working with for a while, but the main one that inspired change was the Illinois State Board of Education, and we are continuing conversations with them because we want to make sure that this legislation actually works, right? And so we need to get as many stakeholders on board and in agreement with what we want to achieve and make it workable for schools. So we removed some of the things that were in the bill, some advisory committees that ISB would have to set up, things like that were responsibilities of ISB that actually, when drafting the bill, we really didn't understand the how ISB was structured, how the board delegated duties. We didn't understand that Illinois was a standard state versus a curriculum or a textbook state. And so we really made adjustments, and we're introducing a bill that has a lot of similarities to what was originally introduced, but we've pulled a lot of things out. And then the biggest new thing for the bill is standards. And I'm going to hand that off to Mike to explain about how Illinois is a standard state and how we're moving to standards. So Mike, if you want to take it.
Great. Thank you, Bridget. Mike Ziri, Director of Public Policy at Equality Illinois, he, him, his pronouns. And yeah, Bridget, you mentioned some really great points about the work we've been doing over the last year since the bill was first introduced a year ago this month. But one of the things is we've tightened up the standards in the legislation, particularly based on conversations we've had with the State Board of Education, because we've learned a lot over the last year and a half of this process, and that Illinois is a standards-based state. Much the way Representative Willis talked about setting the baseline at the state level, and then the school districts implementing that through local control. So Illinois is a standards-based state that the State Board of Education, working with a variety of partners, including, as we've put in the bill, working with youth, parents, educators, and social workers, and all kinds of other advocates and professional experts, working with them to develop the state standards that will then be implemented by the school districts. Illinois is not a curriculum-based state, meaning unlike some other states, the State Board of Education does not say, this is the curriculum to use, and that's what everybody uses. That's not how Illinois, the education system operates. So what we've taken that information and that knowledge, and we've streamlined the standards that we put into the bill, and also really aligned them to the national standards from health educators. And I think it's made for a much stronger initiative going forward, and excited by that.
Thank you so much, Mike. I want to reiterate that certain basic things remain in the bill, in every version of the bill, and that is that all instruction and materials must be age appropriate, developmentally appropriate. They must be medically accurate and complete. That teachers are allowed to answer questions from students related to the materials in the instruction, and that parents have an opt-out, and that parents can remove a child if they don't want the child to have the instruction. We also have strengthened the requirements of schools to post information on their websites and to disclose to parents about what is being taught, and if outside instructors are being brought in, what those outside instructors are teaching, who they are, as well as ensuring that those outside instructors have expertise in the area and are going to be teaching information and providing materials that are consistent with the requirements in the law. So those are some of the highlights of things that have remained consistent. Some of them have been strengthened, but the core parts really have remained the same. Our last question, unless somebody has thought of another one, and again, it's mj@ppil.org, but this comes from Dave Dahl at WBBM Radio. Senator and representative, so it's for each of you. How would the REACH Act have helped you way back when?
Well, I think it certainly would have. I was very fortunate that I had parents that were very open to discussions on that. But I also think that there were times in my life that there were questions that I had, and I didn't always have everything answered for me. Like I said, I was very fortunate. I had a mom that I had a very open relationship with. I was also very active in Girl Scouts, and I think way back when, many of us girls that were in scouting, that's how we learned about our body changes, especially if we changed earlier than our parents realized. And so that was helpful to me, but I also recognized as my daughters grew, and I have 3 daughters who are young adults, are adults now, that not everybody had that great relationship with their parents that I did, or that I hoped to have with my own daughters, because I had many of my daughter's friends came to talk to me and ask me questions. And I was always very open and honest with them. And I think that if they had had that available to them at school, they would have had a much better adolescence than some of them had. And some of them had some troubling things that happened to them. And I was happy that I, as a parent and as an adult mentor to many of them, was available. But it also made me question, what if they didn't have someone available to them? What could have happened, and how their lives could not have turned out as good as it did. So with that, that's one of the reasons why I am so passionate about age appropriate information being available to kids as they grow up through the school system. Because I recognize that while I hope I did good by many young people, everybody didn't have a Mrs. Willis around to go and talk to. And so I want to make sure that everybody has somebody available to them. And that's why I want to make sure this gets into our school systems.
Thank you so much. Senator, if you want to answer now.
That's a good question. I would ask, or I would respond in two ways. One is to build off of what Representative Willis said. I actually, had a different situation. Typically in my family or from my immigrant community, generally speaking, we didn't have these open conversations, and about what was appropriate and what was in terms of interaction and whatnot. And so to have had that would have been really helpful to me in terms of understanding, the health and safety aspect of interacting with folks and whatnot. Obviously, everything worked out. However, as it goes, having more information is always better, and having accurate information is always better. The other part I'll say though is, as someone that comes from an immigrant community, I grew up, and it wasn't until 7th or 8th grade that I went to a school that was incredibly diverse. And before that, I went to, for 4 years to a school that was mostly white. And, a couple of years after that, I went to a school that was mostly Black. And so I was kind of the only Indian American kid in the class, and people didn't know what to make of me, and I didn't know what to make of me being the only one. And there was some bullying that did take place. And, I think that it would have been helpful to have had the REACH Act, to really be in those settings and understand better who I am, and understand, and other kids in the class understand who we are, together, and how to interact with one another, and not, bully or not make assumptions about one another. And so I think those are the two ways that I could have really benefited as a kid, if the REACH Act had been implemented.
Thank you for sharing, Senator. Well, this closes the event. If you have additional questions, if you would like to set up an individual interview with any one of our speakers, if you need follow-up information, then please reach out to the email address you have, mj@ppil.org, and MJ will get you the information you need, or help set up if you want to do a further in-depth interview or anything else like that. Again, thank you all for joining us. I want to thank each and every one of our speakers for joining this event, and I hope you have a wonderful rest of your day. Thank you.